Welcome to the Phoenix Prosperity Podcast, where wealth meets legacy. Join your host, Tim Fergestad, as we explore the journeys of Phoenix's finest to success and beyond.
All right. Hello, this is Tim Fergestad. Thank you for joining us. What if prostate cancer could be treated in an hour with precision, minimal side effects, and some of the best outcomes in the country? Today, we sit down with Dr. Ajay Bhatnagar, founder of the Prostate Cancer Institute of America and a pioneer in low-dose rate brachytherapy. Dr. Bhatnagar, welcome to the show.
Thank you so much for having me here. Thank you for that kind introduction. Excited to be here.
All right. So why don't you give people kind of a background on what brachytherapy is, and then we'll get into sort of how the business model started.
Yeah, it's great. Well, actually, it all starts back when I was in medical school. I went to medical school at the University of Pittsburgh, and I had just left Philadelphia, graduated a degree in bioengineering at the University of Pennsylvania, and I was very interested in applying technologies to healthcare. That's what, and as a third year medical student, I got to observe these doctors performing this treatment that we commonly call the prostate seed implant. And immediately at that point, I knew this is what I wanted to do.
Really?
And since that time, I was able to get into a radiation oncology residency, and then afterwards, I started practice. But radiation oncology involves the use of radiation therapy to treat a variety of malignancies. So I was doing general radiation oncology for many years, treating breast cancer, lung cancer, skin cancer, with different radiation therapy modalities, usually external beam treatment. But I always had a special passion and love for what we call brachytherapy, and specifically it's low-dose rate brachytherapy for the treatment of localized prostate cancer, since that's what got me into this field. And I saw an interesting phenomenon over the past 10 years where the treatment was basically dying. It was the utilization of this treatment it really went away, and not for clinical reasons, more so socioeconomic reasons. And it's actually interesting. What I tell people is that the story of LDR brachytherapy for prostate cancer represents exactly what's wrong with our healthcare system. Here you have the most conformal radiation treatment for men with localized prostate cancer. Mm-hmm. But since it's the most cost-effective treatment, no one does it anymore. There's more lucrative treatments like, proton beam therapy, IMRT, robotic surgery, have significantly increased in utilization, while the prostate seed implant basically has gone away. And at this point now, it really has no one even trained it anymore. All the training programs.
Does it require more training? Is that one of the hurdles?
It doesn't. Yeah, it does require separate training, but there's no one even at these institutions to train anyone.
Okay.
And
that's another hurdle. Well, let's back up for a second. For our listeners who may not know, brachytherapy, what it is, low dose and high dose, and maybe how it's different from maybe other cancer treatments like surgery or maybe external radiation.
Yeah, that's a great way. Sorry for jumping the gun here.
So get into the meat.
Yeah. So, the low dose rate brachytherapy is the permanent implantation of these radioactive seeds in the prostate that give off radiation to eradicate the cancer. And so it's a one-time treatment. It can be done, typically in the operating room, patients under anesthesia, under rectal ultrasound guidance. And these needles are placed through the perineum, and we inject the seeds through the perineum. So there's actually no incisions. That's why it's such a good recovery. And these seeds, there's different radioactive isotopes that can be used, usually either iodine 125 or palladium 103 or cesium. And these radioactive isotopes have properties where the radiation is only distributed within that proximity of the seeds. It typically travels only 5 millimeters, and therefore there's really no radiation outside the treated area, which allows us to give very high dose of radiation in the prostate with negligible or minimal dose to the surrounding critical structures. So it
Right.
allows us to safely give really high doses that provide a better outcome with a better
Just the
quality of life.
cancerous tissue, right?
Yes,
Restricted just to the tissue that you want, unlike
exactly.
like chemotherapy that hits everything and has all those secondary bad
Yeah, and
effects.
even external radiation, right? External radiation, you have the radiation coming from outside in. So you
Right.
still have a low dose of radiation entering the body and exiting the body while the dose is concentrated in the area of interest, but there's still doses of radiation outside that area. Even proton beam. Proton beam actually has entrance dose. It may not have exit dose, but it still has entrance dose. So it's
Okay.
still hitting other tissues outside of the region of interest that
Right.
can potentially be quite damaging. And for prostate cancer, actually, proton beam can actually have quite a significant rectal dose to the rectum.
Okay.
The prostate seed implant, when it's done properly, has a virtually negligible dose to the rectum.
Okay.
And so there's a significant advantage of doing this,
Right.
but the financial reimbursement or the lack of adequate financial reimbursement for this, has led to everyone to do other modalities. So, it's funny because in Canada or Australia, they sort of laugh at us, where there is a um, emphasis on providing cost-effective treatment,
Right. Right.
the utilization is much higher.
Okay. Okay. So people have these big expensive toys over here and they want to use them and charge for
Exactly.
them.
Whereas simple treatment like this is actually the best. And so, while there are modernizations to this treatment that we can go into, like you said, in its sort of essence of what we're talking about, directly placing these seeds right in the tumor allows for, you know, optimal outcomes.
Okay.
Granted, you need to have skill and experience of knowing how to place these seeds, but
Sure.
that's something that can be trained and learned as long as there's a desire to be trained and interest.
And there's people doing it and training in it.
Exactly.
Okay.
You know, and so when I saw this opportunity in 2022 of, basically no one performing this procedure anymore, I decided that I wanted to leave my general practice and solely focus on this treatment to make it available for men across the valley. I was actually practicing in Casa Grande at that time, and I knew patients weren't going to come to Casa Grande for this treatment. And so I decided to, I always lived in the valley, and so I moved up here and actually, had an office in Chandler. Actually, I subleased an office, an office in Chandler from a colleague, a friend of mine. But I quickly realized, post COVID, that patients actually prefer to see you outside the office virtually. I mean, and so I was able to really take advantage of the efficiencies of this treatment because, that there isn't really much resources required to deliver this treatment. I don't need a $10 million machine. I don't need, thousands or hundreds of thousands of dollars of staff of physicists that can medical dosimetrists, therapists,
Right.
all these infrastructure that makes radiation oncology so cost intensive isn't required actually for the prostate brachytherapy. So, even from the office. So, most of my visits are done here. My pre-op and post-op visits are done this way. And I perform the procedure at various hospitals or surgery centers. And that allows me to minimize my costs and make this a viable business.
Right. Right. Okay. So you can perform it throughout different areas throughout the Phoenix area and making it more convenient for your patients.
Yes, exactly. I've been able to provide this at, I mean, actually, I'm in every health system in Phoenix.
Okay.
I'm at Honor Health. I'm at Banner. I'm at Dignity. I'm at Abrazo,
Wow.
as well as other surgery centers. So yeah,
Yeah.
I like to
Okay. Make
think,
it easy.
yes.
Heck yeah.
And this is covered by all the insurances, so that's not an issue. I mean, why wouldn't they want to cover the most cost-effective treatment? So, I've
Sure.
never been
Sure.
denied by an insurance company for this treatment. So,
Okay.
so it's widely available, and there are patients wanting it. A lot of patients, will tell me, that they had an uncle or a father that had seeds and they did great, and so they want it too. And so
Okay.
there is a demand from the patients, but there is still this perception, not only from patients but also from other doctors, that it's an antiquated treatment. And so that's
That's
where education, advocacy, awareness is really important to help
sure.
make sure people understand that this is still, a highly effective treatment for men with localized prostate cancer.
Sure. Let's double click on that one a little bit. And what's another sort of misconception between radiation and surgery?
Yeah, I think well, when we talk about radiation, there's different forms of radiation,
Right,
but
right.
we're talking about brachytherapy, external radiation, and surgery. But I think there is sometimes a conception that surgery is the only treatment for prostate cancer, and the other ones are substandard. But that's actually not true. And so for many men, actually, especially older men, surgery, radiation, or brachytherapy could actually be a superior treatment because it can provide less potential side effects. And so I think there is still a common perception that that surgery is still the most superior treatment for all men, and that's not the case for all men. That's and so that's something that it's not even just with prostate cancer. I just think it's in general for many diseases that surgery is the only way to treat a cancer. It has to be removed, and that is and for many sites that may be true, but with prostate cancer, we have such good outcomes with all these different treatment options that it really becomes about the quality of life that matters most. Which treatment has a side effect profile that I'm most willing to risk, which will result in the best quality of life for me. And that's where, treatment has to be individualized.
Okay. But brachytherapy's pretty hard to beat, sounds like, for side effects.
Yes, yeah, I think for the right patient. I mean, there are some patients that that have big prostates. Those large, they may not be an ideal candidate for this. But for those who are ideal candidates, yeah, and done in the right hands, it can provide an highly excellent quality life with an excellent cure rate, for sure. Um,
Okay.
but
Okay.
yeah.
And we're talking urinary function, sexual function, bowel function, those basic.
That's correct. That's
Right.
correct. When you
Okay.
look at the quality of life studies done, and brachytherapy has been highly published for decades now.
Right.
And when you look at it, it's been shown that the highest erectile function preservation rate is with brachytherapy. The most highest quality of life function scores are with brachytherapy. So you're right. That's exactly right. But it
Hard to
has to
argue with
be in the
that.
right patients, and it has to be done by an experienced operator. It's highly operator dependent. Whereas, external beam radiation for prostate cancer is fairly standard. Any facility providing external beam radiation is going to be doing an adequate job in providing prostate cancer radiation. Okay,
Okay.
it's fairly reproducible, repeatable. The brachytherapy, is operator dependent. And, I can tell you, even in the last 4 years of just focusing on this treatment versus doing it on the side as a general radiation oncologist, my skill set has completely improved. I mean, by leaps and bounds, surgeons will know this, but even anyone else, I mean, the more you do something, the better you get at it.
Sure.
And so how can you expect to be any good at doing prostate seed implants if you're only doing it once every 3 months or once every 2 months
Right.
versus doing it every day?
Right.
And it's hard, right? I mean, as a generation oncologist, we still have breast cancer patients, lung cancer patients, rectal cancer. I mean, it's not just prostate cancer. So by me focusing just on this disease site with this treatment, has allowed me to really hone down on my skill set
Sure.
to provide this treatment, as well as also understand getting a greater acumen of the patient selections of who's going to do well and who's not. And so
Right.
with those two skill sets, in terms of my technical skill and the clinical acumen or decision making of patient selection, I really feel strongly about providing the best outcomes for my patients.
Okay. Okay. Before we get into sort of the business model, right, and your MBA and your training and all the stuff you've geared for that, I have a couple more sort of medical questions, if you don't mind.
Please.
So I guess what's the biggest mistake men make after getting a prostate cancer diagnosis?
The biggest mistake after getting a prostate cancer diagnosis is rushing into a treatment. Okay.
Okay.
It's really important to do your due diligence, to see a urologist and a radiation oncologist, to learn from other patients who have had other different treatments, to feel fully informed. I think sometimes patients rush, they get scared with the C word, and they
Right.
immediately go to their first treatment option that they were offered. And, not that that's necessarily the wrong treatment, but I think it would behoove them to at least make that decision after they've been informed of all the different possible options. And so, prostate cancer is unique compared to other more aggressive malignancies like, pancreatic or lung cancer, where there
Right.
is sort of a sense of urgency. Here we
Sure.
have time. It's a relatively slower growing tumor. So take advantage of that time. Use this time
Right.
to do your due diligence and
Get your best
become
care.
well informed.
For sure. Okay. PSA screenings, helpful or overused? What's
It's been, now there is no question that prostate screening, PSA screening is helpful.
okay?
Okay. But there has been controversy in the past. And in fact, in the early 2000s or mid 2000s, when the United States Preventive Task Force recommended that we abandon prostate screening, there was a huge surge of men presenting with advanced prostate cancers.
Hmm.
And therefore, they had to reverse that role.
Okay.
The challenge becomes in who to screen, and do we do it by age? Because age now is, there's your physiological age and a chronological age, right? And so,
Right.
I mean, we have many 75-year-olds that are very fit and active, and so why should they be subjected to not getting screened just because of their chronological age being 75 when their physiological age could actually be like 60? Right.
Sure. Or vice versa.
And
Right.
so that's the more challenge of, and that's why everyone should be having a discussion with their physician to discuss, whether prostate screening is important for them.
Okay. Okay. And then I guess final question on the technical side is advancements coming up in prostate cancer treatment. Is brachytherapy or other things changing a little bit still?
Yeah, we're definitely getting more advanced with prostate cancer diagnosis, imaging, genetics, to therefore formulate the best treatment. So all of those areas in prostate cancer have made significant advancements, but we're now also making significant advancements in advanced prostate cancer for patients who have prostate cancer spread beyond the prostate, which used to be a fairly a death sentence with limited prognosis and limited treatments available. Now we have a plethora of treatments available, and the latest advancement for advanced prostate cancer, which I'm really excited about, is radio ligand therapy, where we're using these unsealed radiation sources that are delivered systemically through your body, like
Hmm.
an IV. And these molecules are alpha particles that can directly attack the prostate cancer cells that are present throughout the body by these molecules being tagged to a protein that is specific to prostate cancer, what we call PSMA. So it's really exciting. I think chemotherapy will probably be extinct for prostate cancer due to the advancements in radioligand therapy. That's my prediction.
Oh, okay, interesting, very interesting. Okay, now let's talk a little bit about your decision to found the Prostate Center or Cancer Institute of America, and the challenges of running a business in a medical business, no less, in this current climate.
It's very, very difficult to have in this climate of a medical practice for multiple reasons. But that doesn't mean it's impossible. Okay. The first issue with medical practice, especially my medical practice and most medical practice that use insurances, getting credentialed with insurance companies is becoming very, very difficult. And they know they have this leverage over people, especially small practices of mine, and therefore they can, take advantage of you with giving you very low rates.
Reimbursements?
Yes. And that's becomes the first reason not to start your own practice. Because why should I do this and get paid 50% or 70% of Medicare when I can just join a practice or join a hospital that will get much higher reimbursement and therefore indirectly pay me more? It doesn't make sense, which is true. Granted, there's other disadvantage of that, but still, I mean, getting credentialed with adequate reimbursement rates from the insurance companies is very difficult. And in some states, in some metropolitan areas like here, they'll even tell you, we have a full network. We don't need you. And so therefore they won't even credential you. So, it's getting to that point. I mean, but luckily I just really focused on this niche that no one else was performing, and also provided a benefit to them in cost savings, as well as a benefit to their members with great outcomes. And it took me a while to get credentialed. I mean, like Cigna told me right away that they had a full network of radiation oncologists, but I had to explain to them, I'm not your average radiation oncologist. I'm not even doing external beam radiation. And finally, a year later, they eventually offered, a adequate contract to start brachytherapy here in Arizona. So, for starting a medical practice in this current environment, especially, not these cash practices, like these longevity businesses or other ones that are direct primary care business where they are trying to avoid, insurance companies, but I didn't have a choice. Most of my patients are older and have Medicare. And so, and they've been paying into Medicare their whole life. They want to use it. So, it was very important for me to get credentialed with the payers and then also get adequate reimbursement from the payers because remember, I'm still offering the most cost-effective treatment. So, I still have to make this a viable business. And even though I really believe in this treatment and believe it's a great outcome, I really had to focus on what I needed to do to make this a viable business. And, it really came down to overhead, minimizing the overhead and acceptable insurance contracts.
Did COVID inspire some of the remote clinic work?
I'm sorry?
Did COVID and the telehealth stuff?
For sure. I think that legitimized that allowed patients to gain acceptance. When I first started, I didn't think, well, why would sometimes patients don't see me in person until the day of the surgery. And I first thought that was odd for them. But actually by now, no, they've accepted it. I'm not the only person. There's many surgeons that do that and they're comfortable with it.
I don't have to drive and meet you, spend hours in the waiting room just to say, okay, come back in a week and we'll do the procedure.
Yeah, exactly. And, there's good tele-video interfaces that most of the EMRs have that allow for a good interaction on the thing. So, I think the acceptance by the lay community for this definitely helped me to have this practice because I not only practice in Arizona, but I practice in other states around the country where
Okay.
there is a lack of brachytherapy, and I was only able to do that by offering virtual visits for these
Right.
patients in other states such as Colorado or Nevada.
Okay. Okay. When did you start doing branching out from Arizona? Was that from the start?
No, it wasn't from the start. It was about 2024, starting
Okay.
2022. Actually, one of my friends from medical school actually he's in Denver. He's a urologist in Denver and one of the largest practices there. And he said that, no one's doing brachytherapy in Denver. And this is a really important treatment for some of our patients. Would you be willing to come to Denver? And I said, I can, if you're able to, if these patients are okay with me, providing virtual visits and for me to just come for the procedure, that's not too bad. And I like Denver. It's a nice city. Yeah, I don't have a problem doing that. And, uh, and they're actually in Denver. It's very interesting. There are these independent practice associations, IPAs.
Okay.
And there's one in Denver that has been around for a long time. And I joined this independent practice association. And that by joining them, they automatically got me credentialed with all the payers with
Ah,
fairly good rates.
very
So
nice.
that
Okay.
was a real time saver and ability to get adequate rates. It was so that really helped.
Okay. The IPA, what were they called again?
Yeah, Independent Practice Associations, IPA. Yeah,
Okay.
so
Okay.
many. There are some still around the country, not many, but they allow you to not all of them, but some of them are have contracts with payers that allow you to basically automatically
Okay.
get contracted with these payers. So
Okay.
it made it quite efficient. And from a times point and from a financial standpoint,
Yeah, the billing,
and
everything.
yeah, and then also, yeah, I didn't have to negotiate. So yeah, that was very helpful for me to get started in Denver. And yeah, again, there was already an acceptance of virtual health, and I did have to get credentialed at a hospital in Denver, but it wasn't so bad.
Sure. Okay. Excellent. So, looking forward right now, what are sort of your 2026 plans? You're still growing here in the
Yeah,
Valley, or are you branching into other states still?
yeah, still growing in the valley, and different areas, yeah, and growing outside of the in the countries. And I do have partners now on the East Coast and Midwest. And the latest thing is really increasing the advocacy and awareness through digital media and social media. And that I have found to be very successful in terms of increasing awareness and advocacy, as well as increasing my practice. I have a lot more patients that are coming directly. As radiation oncologists, we're typically dependent on other doctors referring us
That's yeah, my
patients.
next question. Okay, yeah.
But now I would say, but now the half of my patients are coming directly from themselves and
Okay.
then
They're
finding
doing
out
their own
about me.
research online and they find you.
Yeah.
Excellent.
So through podcasts like this, through my videos on TikTok, Instagram, YouTube, my website, the Google reviews. I mean, those are really all those different forms of media all add up to resulting in of having a fairly independent business regardless of other doctor referrals, which is sort of
Okay.
unheard of for a radiation oncology practice.
Okay. Interesting. Yeah, and it's not maybe traditional physician skills, right? To be able to do marketing and so forth. Tell me a little bit about when you got your MBA and how that's helped you.
So very interesting about my MBA. I got it actually 20 years ago in
Okay.
2005. I started med school. It was a 1 year MBA program at the University of Pittsburgh. And my friends from med school were like, "What are you doing? Like, we just graduated med school. Like, what are you doing?" I'm like, "Guys, this is going to be important. Trust me. Healthcare is the biggest business in America. we got to learn business. Okay, guys, we got to do this. Okay. And they're like, you're nuts. And I was like, hey, and so, I had, it was the University of Pittsburgh has a 1 year program where they basically cram in 4 semesters of work in 3 semesters. And I had a research year that year, and during my residency, and I was able to, somehow do all that. Wasn't easy, but I did it. And it was a really great year of learning, not only all the content of accounting, the finance, marketing, but also to get to interact with other non-medical people. Because, here I am for half my already just being submerged with just medical people from medical school and residency. And so it
Sure.
was good to see a different perspective, which I think helps me now, dealing with, non-medical people, and think differently. And, while, I can read a financial statement, an accounting statement, that's, you probably still could learn that. You don't need an MBA to do that. But, I think I'm glad I did it. At some point, I thought maybe I would use it to, maybe go into a more administrative career. But I really enjoyed taking care of patients. And yeah, I used my business degree to enhance my medical career. Do you need an MBA to start your own business? No. I mean, does it hurt? No. But I think a lot of my learning of the business was on the job training too. I mean, learning, especially the
Okay.
marketing, in the last few years, really trying to learn. I mean, let's face it. I mean, social media has transformed marketing, right? I mean, from going in newspapers and postcards. I mean, who would actually even offer that to anyone anymore, right? And,
Right. Right. I
and-
have a lot of physician friends who I think they would like to have a little more control over their practice and so forth, but it's overwhelming, right? It would, just having that foundation gives you probably a lot of confidence in knowing that it's possible.
yeah, yeah. And I think now there's so much misinformation out there, that I think it really is important for physicians to be on social media to provide the correct information. And I'm seeing a lot more of that lately, and it's still in the early stages. And so therefore, whether for me to, increase awareness of what I'm trying to do of prostate brachytherapy, obviously indirectly resulting in, in increased business for me. But it doesn't always just have to be about that. I mean, I think right now there's so much misinformation in many parts of medicine, that, it's important that physicians, provide the correct information, because let's face it, social media, if it isn't already, is the number one source of information for everyone. And therefore, if we're not at the table, we're going to be
Right.
eating at the table, so
Right. Right. Okay. Well, wow, you're wearing a lot of hats. Kudos for being able to take all that on and balance it. And you have an incredible impact, obviously, just in your profession in general, but also growing your practice, and that's all great. Do you have any sort of 2026 goals? You gonna trying to get across the whole nation? You want to be in every state? Do you want to what's the goal for the
yeah,
um,
I think, we're growing at a large pace, but I think the goal here is chasing excellence, not chasing trends.
okay, nice.
And so far right now is continuing to do what I'm doing, providing excellent care, but also including is really focusing on the awareness, and I think that really matters. Advocacy and awareness, and through platforms like this, it will eventually succeed. But I really do believe that the 2026, that the use of these digital media forms to increase awareness or advocacy of what I'm trying to do, because I really do think it resonates with everyone. I could have done what I was doing before and had a nice cush radiation oncology job and just coasted.
Mhm.
But instead, no, I decided to change to provide a treatment that no one wanted to provide anymore because of perverse financial incentives. And I
Right,
think, anyone can recognize that is a worthy cause, and then they
right.
can further find out, wait, what is he talking about, and get more curious of what he's doing.
Right.
Because yeah, if I didn't believe in this treatment, I wouldn't be doing this. I mean, I'm a big,
Yeah. I'm going to take the one with with the small with that pays less, But I mean, you have the challenges also of creating an educational platform, which again,
yes,
kudos for that. That's awesome.
yeah, I did write a book.
Oh yes,
Yes. So that was
put it
really
higher. What is it?
It's called Modern Low-Dose Rate Brachytherapy for Prostate Cancer, a comprehensive guide for urologists. It's actually
Nice.
a pretty easy book to read for almost anyone. And so I think I've had patients read it. You can get this on Amazon. It's really easy to read and goes over the basics of brachytherapy, but also goes over the data that surrounds brachytherapy. It's actually very interesting. In the last 5 years, there's been a plethora of recent studies, articles about the superior outcomes of brachytherapy compared to other modalities for
Okay.
various different types of prostate cancer. So, and there's different risk group categories. So, before, for intermediate risk prostate cancer, we would actually do a combination of external radiation and brachytherapy. But now a recent study showed that brachytherapy alone was actually a better treatment than doing both.
Oh,
And that
okay.
was just recently. And so, there's still data. It's actually a lot of the data is coming from Japan, where they still do it a lot. With patients with very advanced prostate cancer, patients can require hormone treatments, what we call androgen deprivation therapy for about 2 years. Okay. And these hormone treatments, can really be symptomatic,
Sure.
menopause for years. And it can really be the worst part of the treatment. And, what we now know is that when you add brachytherapy to the external radiation for these guys, we only need 6 months of hormones versus 2 years.
Nice.
And for some patients, that's a really big deal, you know?
Sure. Sure. Okay. Excellent.
And so there's a lot of data that's very recent showing the benefits of this treatment that has been basically extinct here. And so hopefully people can read and learn more about it.
Yep.
And make sure that they now know about this. The main thing is that we want to make sure people know about it and they've been offered it. Many times patients will come to me and say, "Hey, no one even told me about this. I don't even know about this. They said that no one does it anymore." So, hopefully through events such as yours here, there'll be at least
Right.
one person that learned about something I do, and that's made it worth it.
Right. Right. We'll train the algorithms and get AI to bring it up when people ask.
That sounds great. That sounds
Yep.
great.
All right. All right. Dr. Bhatnagar, if people would like to connect with you, learn more about the Prostate Cancer Institute of America, where can they go? What should they do?
Yeah. Well, they can go to my website. We can give my email, phone number, but my website has good contact information for our phone number, our email. But yeah, I'd be more than glad to give my personal email and phone number here for patients for anyone to get in touch with me. That's not a problem at all.
All right. We'll put it in the show notes if you want to share it with me.
Yeah,
That'd be
for
great.
sure. For sure.
All right. Well, this has been great. Thank you very much, Dr. Bhatnagar, for joining me today. Thank you, everybody, for listening and watching. Appreciate you sharing your insights into not just medicine, but running a business in the health space, all those challenges.
Thank you so much. It was a pleasure.
Inspired by our guests? Visit PhoenixProsperityPodcast.com/guest and join us on the show and share your success story with Tim. The spotlight awaits.